I was sick all the time. I mean, I was barely functioning as a human. I took time off work. I missed like 3 months of work a year, just about, from being hospitalized, from secondary infections, from colds and flus.
If you are watching this program, you or someone you know needs therapy with intravenous immune globulin. This video will help acquaint you with intravenous immune globulin treatment and how it is administered, and answer some of the questions that you may have about it.
It's interesting that medical science, I think, is identifying more and more instances where intravenous immunoglobulin may be helpful, either in the short term or even for long-term therapy, replacement therapy. But the condition that I most often use it in as a pediatric immunologist are in those children who either never begin to produce their own antibody or, for one reason or another, do not produce enough of it over time. So we most often use it to replace deficient levels of antibody in certain children.
He was fine until he was about 4 months old. And then he just started, that's probably about the time that the immunities wear off, you know, after being born and everything. But he started wheezing, started doing a lot of coughing and everything, and just constantly had ear infection after ear infection. Got so bad one time that he had, we had tubes put in. And even though he had the tubes, he got Haemophilus influenza, which is real contagious with kids and can be fatal. It's like I had to keep him away from everybody, because anybody, and I would just cringe when a neighbor kid would come over with a runny nose. I'd send him home.